Okay, welcome. Good evening, everyone. Thank you for joining us for today's webinar. Let's begin with quote. Try to learn something about everything and everything about some. So, for today, starting a new chapter of learning, I, Tanisha, being your host for today's event, wants to extend a warm greeting and good evening to all of you present here. I hope you are all doing good. On behalf of whole SEMS family, I welcome you all for today's international webinar on the topic breast cancer awareness. And to add our guest of honor and today's speaker, Dr. Neeti Likha Chavra. It is a great honor to have you with us. Before I proceed, let me take a brief moment for the introduction of my organization. SEMS Welfare Foundation is a non-profit entity established to work in the area of education, social welfare, women empowerment, skills development, and entrepreneurship, livelihood generation, employability, and health research, culture, international cooperation, sports, environment protection, or any other similar sectors. We promote healthy lives, a balanced and active community, and strong business. Next, let me introduce our topic intro, which is a breast cancer awareness. Raising awareness of the scope and seriousness of this disease is one of the most important and impactful function of breast cancer events and promotional items. Naturally, slogans helps raise awareness, but they can also educate people about cause and make breast cancer fighters and survivors as well as their loved ones feel more united as a group working for cause. Early detection save lives. Next, let me introduce our guest of honor, Dr. Neeti. Dr. Neeti, founder of Yes to Life, is a breast cancer winner who deal with the disease at the age of 31 with positive attitude and strength. Yes to Life is an NGO that started in 2014. The team is working towards breast cancer awareness, cancer screening, and patient support. Dr. Neeti vision to contribute to reduce mortality rate arising from breast cancer is their driving force. She is a TEDx speaker and also an author who writes about life, positivity, and happiness. She is a professor by profession, but left her full-time job to follow this passion of spreading awareness and providing support. Over to you, ma'am.
Hi, thank you everyone for having me over, and thank you for understanding the need for spreading awareness for breast cancer. So yes, my name is Neeti, and as introduced, I've been through breast cancer, so I'm a breast cancer winner. Just to start, I'd like to share with you as to how did I get diagnosed, because most of us don't really think that something like cancer can happen to us. At least to me, cancer always looked like a very filmy bimari to me, like something that you only see in the movies. Every time, a doctor says that, you don't have much time, ya aapke paas zyada time nahi hai, it somehow that they're going to show the person has cancer, So that's the kind of image that I'd always had about cancer. And thankfully, there was no family history. So my mind never ever went to doing a screening of myself, of doing a self-breast exam or going to a doctor to get myself screened. But I was very lucky. God has been very kind. It was just while taking a bath or changing clothes that I felt a lump on the surface of my breast. Thankfully, it was just on the surface. Otherwise, a lot of times tumors can be deep within the tissue of the breast also. And I thought that it's related to menses, since during periods, a lot of us feel certain changes in the breast. And I slept over it for whole 2 months, thinking that it will go away. And I'm a very carefree person generally. So those 2 months, I completely forgot about it. The moment I thought that, it's related to menses, I forgot about it. 2 months later, I suddenly realized that the lump was still there. And that is when I knew that there's something grossly wrong. But I was very naive. I did not even know who to go to if you have a lump in the breast. I didn't know that somebody as a breast surgeon, somebody specializing in breast surgery also existed. So I actually Googled to see who do you go to if you have a breast lump. And I took an appointment and, me and my husband went to the doctor for the investigation, which was an ultrasound. Ultrasound was done and we were told that the lump was benign, which means non-cancerous. Benign is non-cancerous and malignant is when it is cancerous. So you can imagine how happy we must be. I remember dancing, sitting in my car, and I shouted that, yay, I don't have cancer, and I was so excited. But again, like I said, God has been very kind. Thankfully, the doctor said that since it's a breast lump, let's not take any chances. And I was 31 at that time, and this is like 10, 11 years back. This was 2012, at which time it was not as common as it is now, for girls this age to have breast cancer. We see girls even in their 20s getting breast cancer now. And the reason that I heard, one of the doctors who I work very closely with has just operated a 17-year-old girl for breast cancer. So the age at which girls are getting it is becoming younger. But at the time when I got it, we hadn't heard much cases of, young girls having breast cancer. So many times, what happens is that even if you go to a doctor, the doctor might just look at you, see the age and say, I don't think it's cancer, and you get, derailed in a different direction only. But like I said, thankfully, the doctor whom I had gone to said, that since it's a breast lump, let's not take any chances. And she asked me to get an FNAC done, which is a fine needle that they put into the tumor to check it. And when the report came, we got to know that it was cancer. And I remember we went to my parents' place after that, to tell them the news. And everybody was crying. It is a very scary word. I know so many people who fainted in the doctor's room, when they are told that they have cancer. And I remember that I was the one who was hugging everyone and consoling people, like my family members, that don't worry, it's going to be okay, I'll be fine and everything. And somehow, I have this very strong faith that I'm going to be okay. I did not know the stage by then. I did not have any information about cancer per se also. But I just had this faith that I'm going to be okay. I did not think about dying. I did not really think what lied ahead of me. I just knew that I'm going to be fine. And I told everybody in my family to think on the same lines, feel very positive, so that, I'm surrounded only by positive energy and faith. And that is what we all did and maintained. As a part of my treatment, I underwent mastectomy, which means that one side of my breast was removed, followed by chemotherapy, followed by hormonal treatment for 6 years. Now, here I'd like to share with you, that many of us are also scared of breast cancer because we think that it will always lead to the woman losing a breast. One, it is not the case. If breast cancer is diagnosed at an early stage, in most of the cases, a breast conservative surgery is done, which means that just the part of the lump and some margins around it is taken out, and the shape of the breast is almost similar, to the other side of your breast. In my case, while it was a early stage cancer, it was stage 1, but due to some technical reason that I'm not going into the details of, I had to lose a breast to cancer. But the only thought in my mind, when I was told that I had to undergo this type of a surgery, was that if I get to live by losing a breast, then so be it, because I love living, I love my life, and I did not want to let go of it just because I had this fear of what will happen to my body image, if I lose a breast. There are a lot of ways to take care of body image now, even if someone has to lose a breast to cancer. There's an artificial breast that comes, that you keep it inside your bra, and it gives you exactly the same shape, So other than you and your partner, nobody outside can get to know that you don't have a breast. Then there's breast reconstruction also, which is possible, So there are lots of ways and means by which you can continue to maintain your normal body image. So that is the whole story of my being diagnosed and the treatment that I underwent. And as introduced, I was working as an associate professor. And, so I thought that I underwent certain experiences during my treatment, like I remember once I went to a government hospital for a second opinion, and I saw so many patients lying on the floor, they were waiting for their turns for chemotherapy to come. And I met a lot of young mothers. My son was 3 years old when I got diagnosed, but thankfully it was an early stage. And like I shared with you, that I did not have fear of losing out on life. I did not think on those lines, but I met a lot of women during my treatment who were my age group, who had very young kids, and just the thought that, how fearful they must be, how tense they must be, because if you're getting diagnosed with breast cancer at a later stage, the chances of it being cured are very low. So, that really gave me a lot of pain to think, that what must they be going through? And these two triggers basically made me realize that I wanted to do something in this area. And that is how Yes to Life emerged. I'll just start to share about the NGO now. Yeah. So our motto is screen, sensitize, support, our 3 pillars of hope. So under screening, what we do is we give awareness talks like the one that we're having today in physical environment, online, offline, everything. And we give these talks to schools, universities, corporates, slums, factories, everywhere. And whenever we give a talk to a factory or a slum, we always follow it up with a free of charge screening camp for them. So we take screenings to them. Then, it is so important to sensitize our society about breast cancer because one, cancer is still a taboo in major part of our country. And if it is of the breast, then it is even a bigger issue, because supposedly breast is just a sexual organ. And, we've had such funny instances when we give these talks about how shy people are really to talk about their own body part, which is breast. I remember we went to a factory once and I was supposed to tell them how to do a self-breast exam. So I generally asked the ladies that, all of you must have touched your breasts. So they started looking at each other and giggling, like those shy giggling, and most of them said no. And I said, if you don't even touch your breast, then how do you take bath? One of them actually stood up and she showed me. She said that we apply soap from the lower body up till here, and then we apply soap from here up till the head. So they were so embarrassed of their own body part that while bathing, they would not even apply soap. And these were all married women, so I literally had to tell them that you have a physical relationship with your husband. You let him touch you, but you can't touch your own body because of so much embarrassment. And this is the case with so many educated households also. It is not just with the uneducated. Even in so many of our households, you may have noticed that when we wash our clothes, we hang women lingerie at a back rope, where no one can see, or under a dupatta or a towel so that nobody would be able to see. While men's underwear, they're proudly hanging on the front row, right? Now, the point is not for you to purposely put out your clothes on the front row for everyone to see. But the point is that why do we have to think as to where should our clothes go and where can men's clothes go? So much is the embarrassment about our own body part, about our own clothes, that and everybody knows what we wear, what kind of clothes do we wear, what kind of undergarments do we wear. So what we keep telling people about is how important is sensitization, because the way that I'm talking to you so candidly, I hope that you would also speak to other people in the same way. And this is what we keep telling everyone who we give an awareness talk to, that sensitize people about the topic. We've seen so many cases where the women went to the doctor or to the family in the later stages of cancer because she was so shy of sharing it with people, or she already knew that she would, that this news would not be taken care of well by the family. So let's empower everyone around us, one, to not be shy of their own body parts, and two, to take hold or take responsibility of your own health, so that you don't have to depend on someone else to take care of your health. Then under support, we give three kinds of support. One is financial support. So we've been helping a lot of patients, with financial treatment and diagnostic screenings who can't afford the treatment or the screenings on their own. We do provide emotional support. So we have a breast cancer support group that has around 150 cancer warriors. And we also provide rehabilitation support. So like I shared with you about ladies who have to undergo mastectomy, if cancer is diagnosed at a later stage. So we put a kit together, which is called a Sati kit. We have an artificial breast in it, which is called prosthesis. We have two special bras that are needed to put that prosthesis inside. We have a headscarf, for all the chemo hair loss. And we have a pair of earrings, which is just to make them feel special, normal, to tell them that you can still dress up, look good, go out. And we've been distributing this kit free of charge to a lot of hospitals, to a lot of patients across Delhi NCR. And post-COVID, we have also been couriering these kits to people across the country, whoever needs it and who is from a lower income group. And a year back, we started this breast care center in Sector 45, Gurugram, which is primarily for all the ladies who come from lower income group. So what we've been doing is that we pick up one village at a time. So when we started, we picked up Kanhai village, which is in Gurgaon. We finished whole of Kanhai village. So what we do is we do door-to-door awareness campaigns. 3 days in a week, our team goes to the village, literally, presses the bell, calls people out of their homes, gives them brochures, tells them how to do breast, self-examination, what are the signs and symptoms, what are the risk factors, when do you have to go to the doctor, explains everything to them. And once in a week, which is Friday, we do screening camps again in the villages. We go with a team of doctors and we do camps for these ladies. And every Monday, we run a free breast cancer OPD at this center, which is in Sector 45. Where we have Dr. Kanchan Kaur, who comes and takes the OPD. She's the Senior Director, Breast Services with Medanta. So we have, from Monday to Friday, we have free OPD. We have door-to-door awareness campaigns. We have free screening camps. And whoever comes to our screening camp, which is again from lower income group, to get a consultation, no matter what kind of screenings do they need, ranging from ultrasound to mammography, nipple cytology, PET MRI, biopsy, whatever it is, we pay for their screenings, we get their screenings done. And for people who get diagnosed with breast cancer, we take care of their treatment also. We support them through the treatment. We don't tell them that you have cancer or you might have cancer and we leave them. We don't do that. So we finished the first village, which is Kanhai. We've reached out to more than 1,000 families there. And now we've started with Wazirabad village. So all of these same things are going on there as well. These are just some of the pictures from the awareness talks that we've had, some of the screening camps that we've had. And these are all the beautiful faces of breast cancer winners, So this is just to tell you that cancer does not mean end of life. Rather, for so many people, including me, our lives have become so much better post cancer. And if you ask me, honestly, I do not want to change anything that I've been through, because this experience has taught so much in life. It has given me a purpose in life. And every time, every day when I'm doing something in this field, the amount of happiness and peace that I feel, I won't trade it for anything else, So it all depends the way that you take an experience. And for me, and for so many of them, the pictures whom you're looking at, life has become much more beautiful post-cancer. She's one of the patients whom we've helped financially. This is the kit that I was talking about, Sati kit, which we give to women who have to lose a breast to cancer. These are some of the events that we've had. So we keep doing a lot of awareness events for general public at large. We also do a lot of support seminars for breast cancer survivors every year. And this is some of the media presence that we've had. Now, what is the reason why we're having today's talk? One is, of course, to reduce fear. So like I shared with you that, I know of women who fainted in the doctor's room when they were told that they have cancer. And mostly everyone, who's been told ki aapko cancer hai, the first thought where their mind goes is death. So I want to share with you that breast cancer, at least, is a type of cancer that can be cured if diagnosed early. So the only thing that we have to keep in mind is awareness. What time do we have to go to the doctor? That is all. Then we'll separate some facts from myths, like what kind of bras to wear, or can antiperspirants lead to higher chance of breast cancer, etc. I will tell you how to do your own self-breast exam and what are the screenings as per age that should be done. In India, more than 50% of women go to the doctors when breast cancer has reached an advanced stage, which is so sad because while in India, the incidence of breast cancer is lower than some of the other nations like USA or China, but the number of mortality rate, which means number of deaths in India because of breast cancer, is much higher because the ladies are still going to the doctors, when the lumps are so big that, it is very difficult to save their lives. Now, why is this happening? One, of course, is that there's lack of awareness. Women don't know that if they're finding a change in the breast, then it really has to be shown to a doctor, something that it could be very serious. And also I feel that we really lack, social support. I've just had a patient from Meerut last Monday at a center whose, tumor was fungating, which means it had bleeding all over. It was this big in size. But she did not go to a doctor because she is again from a village in Meerut. And she told us that her mom-in-law kept on telling her, that this is nothing, just keep wiping off your blood. There's nothing. And now she has cancer in almost all the body parts of her, and it is very difficult to save her life now. So when I see such patients, I feel so sad because, it's just a matter of being aware and having that kind of social support that can really, really help you to reach the doctor at the right time. So, and perceived social stigma is what I'm talking about again, that if it is for all of us, that if we feel free to talk about it, if we don't feel embarrassed about it, we would be able to help out so many more people. And we would also be able to seek help for ourselves, if there is a need ever. Then ignorance of some doctors or incomplete investigation. So in my case, like I shared, that the first round of investigation, which was ultrasound, that said that the report was benign. Thankfully, the doctor advised for a second test and we went for it. But we've seen a lot of times that, the patients are not guided in the right direction. But as women, I want to tell you, and even the boys who are listening to this one, this is for your own good also, we'll come to that. And two, please share this with every woman who you know, right? All boys, all girls. So as women, we are very intuitive. You may go to a doctor, the doctor tells you, oh, it's nothing. But as a woman, if you still feel, if you don't have that peace of mind, if you still feel that there's something wrong, if you don't have that kind of satisfaction after meeting the doctor, then please go seek a second opinion. If there's something inside telling you, don't just let it be. Myths and alternative treatments. So here I'm talking about other modalities of medicine such as Ayurveda, homeopathy, or naturopathy. Now, not against any of these modalities at all, but, in my 10, 11 years of experience of being in this work, I have not seen anybody being cured of cancer only by using Ayurveda or naturopathy, right? So I always say that you can use these modalities of treatment as complementary, but not as alternative modes of treatment, right? So have your normal oncological treatment, and then you can have these as complementary therapies. And last but not the least is can't happen to me, so this is something that was shared with me by my oncology my treating doctor 11 years back. When I asked her, when I was meeting so many girls my age who were being diagnosed at such later stages, I asked her that why is this happening. She said, one of the reasons that she told me was that a lot of women who go to her, who are especially in the ages of 60s and 70s, when asked, and they have such big lumps, that they can't be, that, they would not have been able to ignore. So when the doctor asked them, ki, aap time pe kyun nahi gaye? Why did you not go in time to the doctor? So many of them said that, oh, doctor, we thought that it can't happen to us. We've been such good human beings in our life. No, trust me. I mean, I'm a good mother, sister, daughter, friend, wife, everything, but it still happened to me. If you have viral, do you think that, oh my God, viral, how did I get viral? I've been such a good human being. If you get a fracture, you call your friends to write on your cast, right? You call up 10 of your friends to tell them, that, oh, I've got a fracture. But when it comes to cancer, somehow everything becomes about karma and how bad a person you are and whatever. So even for people who believe in that, then there are your past lives also, that you don't know about. So let's also spread this message that there's nothing to feel embarrassed about if you've been diagnosed with cancer. It can actually happen to anyone, irrespective of how bad, good, mediocre a person you are. If viral can happen to anyone, cancer can happen to anyone also. Now, this is how, breast cancer progresses. If you want to understand more about breast cancer, it is important to know about this also, because a lot of us keep talking about stages of cancer. Somebody gets diagnosed, we say, kaun se stage pe diagnosed hua hai. So most of the cases of cancer, they start in the ducts, okay? If you see in the diagram, there are thin pipes which are called ducts. These ducts take milk from the gland to the nipple, okay, when a lady is lactating. Now, if breast cancer is diagnosed at this stage, then it is usually a stage 0 breast cancer in situ, wherein just the part of the lump is to be taken out, and the patient mostly doesn't even require chemotherapy. If not diagnosed at that stage, then the cancer cells can proliferate from the ducts to the breast tissue. That is when it may form a lump. Now, if a lump is formed, it could be a stage 1 or stage 2 breast cancer, depending on the size of the lump. If not diagnosed at that stage, then the cancer cells from the breast can move to the lymph nodes in the underarm. Okay, you must be aware that we have lymph nodes in our underarms, in our neck area, in our groin area, etc. These lymph nodes carry lymphatic fluid throughout our body, right? Now, if cancer cells have migrated from the breast tissue to the lymph nodes, then it could be a stage 2 or stage 3 breast cancer, depending on the number of lymph nodes involved and depending on the size of the lump. And if not diagnosed at that stage, then the cancer cells from the lymph nodes in the underarm can go to any vital organ of the body. It could be bones, brains, lungs, liver, anyway, right? That is when it becomes metastatic, or a stage 4 breast cancer, when it becomes extremely difficult for it to be cured. So again, nothing to be scared of. The only point being that we need to be aware about our body. We need to be aware about any change happening in the body. We have a pimple, and the morning we know, oh my God, we have a pimple, and we'll apply aloe vera and this and that to to take care of it, right? So it's just that we have to be aware and responsible for whole of our body, and not just how we're looking, or just the face. Now, what are some signs and symptoms that we need to be aware about, since we've been talking about taking care of ourselves? So one thing that I want to share with all of you is that all of these signs do not necessarily mean that it is cancer. It could be some other problem also. It could be something related to hormones also. But you must go to the doctor if you find any such change, right? It is only the doctor, or through certain screenings, that the doctor can tell you what kind of a change is it, whether it is malignant or it is non-malignant. And even if it is a benign change, you still might need some medication, right? So the point is that you must go to the doctor in the right time. So the first being that if there is a persistent lump in the breast, in the underarm, or any area up till your collarbone, okay, something that is not going off, then please go to the doctor. And most of the breast cancer lumps are painless. A lot of us think that, oh, if you don't have pain, then there's nothing serious. But most of the breast cancer lumps are painless, while they can pain also. Okay, so if there is a persistent lump, then please show to the doctor. If there is a persistent change in the texture of the skin, if it has, the skin of the breast has thickened, it has become like that of a fish, it has become scaly, then please go to the doctor in the right time. If there is any change in the color of the skin, if it has become blue from a certain part or red from a certain part, then please go to the doctor. If you look at the second picture, there's a dimple in the breast, right? So if you have any puckering, any dimpling in the breast, go to the doctor. For most of us, the nipples are protruding out, right? If you see that the nipple is now inverting in or has pulled inside itself, then go to the doctor. If there is blood or water coming out of the nipple, please go to the doctor. And if you feel that there is any change in the size or shape of the breast, now for most of us, both the breasts are not exactly same in size and shape. But if it has been like that since the very start, then there's nothing to worry. But if you feel that there is a change now in the size or shape, then please go to the doctor. And again, to say that there's nothing to become paranoid of if you feel that there's any change, it only means that you have to show to the doctor in the right time. Now you must be aware that there are certain types of vaccinations, for prevention of certain types of cancers. But unfortunately, there's nothing in place for breast cancer. And breast cancer typically is a lifestyle related disease, like you have high blood pressure, diabetes, etc. Now, while we cannot have a vaccination and say that we will not have breast cancer, but if we understand certain risk factors, we may be able to keep breast cancer away. The percentage of us, the risk factor that we may have it will become lower if we're taking care of these risk factors. So one, of course, all the women have a higher chance of having breast cancer than men, but breast cancer can happen to men also. These are 1% of total cases. Then as we grow older, like I shared with you, that since this is a lifestyle disease, so like when you grow old, you have higher chances of having hypertension, diabetes. Same is the case with breast cancer. If you have a family history of breast cancer, uterine cancer, or if you have a family history of prostate cancer in men, then also you have higher chances of having breast cancer. Which means your mother, sister, daughter, Marcy's daughter, like your cousins, or your father has had any of these cancers, then you have a higher chance of having breast cancer. But unlike the popular belief, that if you don't have family history, then you can't have breast cancer, that is absolutely wrong. And rather, breast cancer happening because of heredity in the family constitutes only 5 to 10% of such cases. Rest, everything is happening because of your own gene mutation. Then anybody who's had very early onset of periods, say before the age of 12, or late menopause after the age of 55, also stands at a higher chance. The reason is that one of the most common breast cancers is hormonal in nature. So when someone gets very early periods or very late menopause, that means that they have had to undergo more cycles of periods, which means more production of hormone in the body, therefore a slightly higher chance of having breast cancer. Then any lady who doesn't have a biological child, or who gave the first birth after she turned 30 years of age, also has a higher chance. Then anybody who's had a history of breast, uterus, cervix, or ovarian cancer also stands a chance. Then obesity, yes, obesity is also one of the contributing factors. And the fat, especially which is around the abdomen area, is very risky. Diet, I think all of us are aware of, our parents have told us enough. Whether or not we follow those footsteps is on us. But of course, eating too much processed food, fatty food, alcohol, smoking is extremely injurious to our health, not just for cancer, but for so many diseases. Then lack of physical activity. This is one of my favorite questions to ask when we're doing it in an offline mode, that how many of you really do physical activity? Here, we're talking about two kinds of physical activities. The first one is not leading a sedentary lifestyle, right? Which means that you're getting up from your seat every some time, you're walking around, you are not just sitting slouching the whole day, okay? So even if you're working from home, if you're studying from home, make it a point to keep walking after every 1 hour, take all of your calls while walking, do stretches after every 1 hour, but your body should not be in a sedentary state for long. And secondly, very, very important when we talk about physical activity is that you must do regular cardio exercises, which means at least minimum 4 to 5 days of a week, 40 to 45 minutes of cardio exercises. And there's so many studies that show that anyone who does regular physical exercise, cardio exercises, that person's risk of having breast cancer reduces by 30%, which is huge. And it is not just with breast cancer, all of your lifestyle diseases, hormonal imbalances, doing regular exercising can take care of so many of these issues. Then stress, we stress a lot on not taking stress. And I know mostly people say that it is easier said than done, but trust me, it is not that difficult also. If we have time in the end, I can share a few things that I have learned through my experience of of going through cancer and how to manage stress in a much, much better way. But yes, it is a very important factor. Then anybody who's had radiation to chest over the age of, before the age of 30, because of some other medical issue, also stands at a higher chance of having breast cancer. Then hormones, a lot of girls these days in their early years have PCOS, PCOD, polycystic syndrome, ovarian syndrome. So one thing is that, and this is also for your moms and the older women also who may be undergoing menopause. Let's try to put minimum amount of hormonal tablets inside us. Okay. Many of us may be taking birth control pills or taking pills to start periods, to stop periods, to not have a baby, to get, some of us may be having, not us if all of you are a young group, but then your moms or your relatives may be having hormone replacement therapies, if they're undergoing menopause. But please make sure not to put extra hormones inside your body if it can be avoided. So as a mode of contraception, instead of taking birth control pills, you can use condoms, you can use other things. But putting extra hormones in your body, if it can be avoided, is one of the best things to do. Then genetics, like I shared with you, that 5 to 10% of breast cancer cases happen because of genes in the family. And then, there are a lot of new emerging studies also that show a couple of risk factors. The first one being lack of vitamin D. And this is something that came up even at the time of COVID, in past 2 years. So please get your vitamin D levels checked. If they are low, then please take supplements as per the doctor's advice. Exposure to chemicals in plastic. This is something, that WhatsApp University has done a good job in, while I don't like it at all. But you may have seen a lot of messages that do tell you that you're not supposed to heat plastic, which is absolutely right. Not even in microwaves and not even your Tupperwares. Always and always use glassware when you're heating something in a microwave. Then exposure to chemicals in cosmetics and personal care products. So please check all your personal care products for parabens and phthalates. These are two types of chemicals which are carcinogenic in nature. And I'm not asking you to change or replace everything that you're using, but any personal care product that you're using on a regular, on a daily basis, it could be a shampoo, it could be a lip balm, at least change those items. Then exposure to chemicals in food. Of course, we know that, all the fruits, vegetables that we eat today, many of them have huge amounts of pesticides and chemicals in it. One way to take care of it is by going organic, but one, organic is a very expensive lifestyle, may not suit everyone. And two, we don't know how organic is organic in India. So unless, of course, you can find a genuine organic vendor. If going organic is not possible, then please soak, wash, peel as much, fruits and vegetables that you buy, because that also takes care of a lot of pesticides and chemicals. Then if you're eating grilled, barbecued or smoked food from outside on a very regular basis, then please reduce the frequency, because they do put a chemical for that smoky effect, which is also carcinogenic in nature. So we've been talking about being aware. We've been talking about, how to catch breast cancer early. How to catch breast cancer early comes from the fact that I'm going to share with you how to do your own self-breast exam every month and what are the screenings that you should be getting done by the doctor, okay, as per the age in point. So the first type of screening starts at the age of 20. Every girl after the age of 20 must do self-breast exam every month. It is like 20 till you die. Okay. The best time to do the self-breast exam is after a week that you get your periods. So if you get your periods on 1st of July, then 7th of July, 8th of July is the best time to do self-breast exam. Women who do not have periods, whether they are pregnant or they have had menopause, can do it at any time of the month. They can just finalize a date so that they remember. And even for somebody who has periods but has forgotten to do that self-breast exam after a week of getting periods, please do it at some other time, but it is very important to do it. I'll teach you how to do it. So this screening start with a self-breast exam every month after you turn 20. Then a clinical breast examination that gets added to self-breast examination. A clinical breast examination is just a physical examination, by touching, that your doctor does for you because she or he is much more experienced. This you should get done once every year after you turn 30. Added to that is a mammogram. Mammogram is nothing but it is an X-ray of the breasts, okay? And the frequency is between the age of 40 to 50, once in every 2 years, and after 50, once every year, okay? And I really, really want all of you to share this information with your elders, your moms, your sisters, chachis, masses, everyone, right? Because this is not only for you, this is for every lady that you know. So self-breast exam every month after 20, added to it a clinical breast examination by a doctor every year once after you turn 30, added to it a mammogram once in 2 years between the age of 40 to 50, and once a year after you turn 50. So I'm sharing this picture here, which tells you how to do a self-breast exam. Please take a minute to see, and then I'll explain it to you. Okay, so I'll just tell you how to do a self-breast exam, and then we'll go back to the PPT. So, this, like I shared with you, that this has to be done once every month after you turn 20. So how you have to do it is lie down on your flat bed. You can keep a small bed sheet, folded and keep it under your shoulder. Put one hand behind your head and take these 3 fingers of your other hand. Okay. Now, how you have to do it is that you have to rotate your hand in circular motions. Imagine a 1 rupee coin. Okay, the size of a 1 rupee coin. Okay. Just rotate your hands in circular motions on your breast. You can just imagine and divide your breast into 4 quadrants, so that you remember to cover each quadrant. Then one by one, cover your whole breast. The area that you have to cover is your whole breast until your collarbone and then your underarm. Okay. Do not just keep pressing it, because you'll not be able to feel a lot of changes if there are. But the best way is to rotate. And when you're doing it, once apply very low pressure, then apply deeper pressure, and then apply very deep pressure, because there might be some cyst or some lump deep in the tissue of your breast or on the surface of your breast, right? Now, once you've done this, stand in front of the mirror, and you have to repeat the same on the other side of the breast also. Once you've done it here, please do it here. Like I said, the whole of the breast up till your collarbone and your underarm. Once you've done this, stand in front of the mirror without your clothes and bra, of course, again. Keep your hands on your waist and push your shoulders forward, okay? And just look at your breasts from all the angles. What are you looking at is if there is any change in the color of the skin, if there is any change in the size or shape, if you feel that there is any change in the skin, the texture of your breast. And those of you who have heavy breasts, please pick up your breast to see the skin underneath. And in the end, just press your nipples to see if there is any discharge coming out, right? And this does not take more than 10 minutes. So let's all of us pledge to ourselves today that we will take out 10 minutes every month, right? We may not think that it is that important. We may not keep it as a priority, but I am sure that we can subtract 10 minutes of watching Netflix or Amazon and do this 10 minutes of a month, right? Not much. Sorry, give me a minute. Okay, this is something that I've shared with you already. So this is the mammography machine, and if you tell your elders to get a mammogram done, some of them may say, that no, it really hurts, but it doesn't hurt as much. It just causes some amount of discomfort because your breast is pressed between 2 plates. Also, if you're going for a regular mammogram or a clinical breast examination, for that also, the best time to get it done is around your 1 week after your periods, if you're having periods. And if there are no periods, then of course any time of the year you can get this examination done. But if you are finding any change in the breast, then you must go to the doctor right then you don't have to wait for a particular date to go to the doctor. Now mostly if somebody does find a change in the breast, say someone finds a lump in the breast, there is usually a protocol that should be followed. I'm sharing this with you because at times, doctors do hurry up to get you admitted, and they may not make you undergo a step or 2, which may lead to another, set of surgery for you, for anyone who's had a change. So I just want to share with you the usual protocol or the norm which is followed. So if somebody does find a lump in the breast, one must go to the doctor. Now, if you find a change in the breast, please try going to a breast surgeon, a breast specialist, rather than a general doctor or a gynecologist, because they are, of course, more experienced at this. Now, the doctor will firstly, do a clinical breast examination, physically check you. And if you are below 40, an ultrasound may be advised. If you're above 40, then a mammogram may be advised, or both in certain cases. The report of mammogram or the ultrasound is not conclusive, but a doctor may feel that you need further investigation. Then the person is usually sent in for an FNAC or a biopsy. Both of them are needle tests, but they're done for different purposes. And if FNAC or biopsy shows that it is a malignancy, then in most of the cases, the doctors will send the patient for a full body PET scan to see if cancer may have spread in some other body part also, because then the line of treatment will be dependent on that, right? So this is the general protocol that is followed if somebody does find a change in the breast. Now, since we talked about high risk factors, quickly let's go through some of the things that we can do to bring down these risk factors, right? So it starts with avoiding to take extra hormones, like I shared with you. So no birth control pills, not taking extra hormonal tablets if it can be avoided. And if a doctor does put you on hormonal tablets, if you have a family history of cancer, then please let the doctor know, because the doctor may prefer one hormone over the other in such cases, because not all hormones are equally harmful for you. Then get to a healthy weight and stick to it. And of course, I'm not talking about joining VLCC and the likes here. I'm talking about exercising regularly and eating right to get to a proper weight. Get regular exercise, so don't lead a sedentary lifestyle, and do proper cardio exercises. Limit alcohol use, stop smoking completely, get fresh air, get enough vitamin D. So like I shared with you, please get your vitamin D levels checked, and if they're low, then take supplements as suggested. Soak, wash, peel as many fruits and vegetables as possible. Then this is the list of certain items which are very, very high in pesticides and chemicals. And the list to your right talks about certain food items which are relatively clean and they're very low in pesticides, right? So if you can't go organic fully, or if you or your family members don't have time to soak, wash, peel everything, then at least please take care of the list on your left, which are very high in pesticides, which includes apples, celery, strawberries, peaches, spinach, grapes, sweet bell peppers, potatoes, blueberries, lettuce, kale, cucumbers, cherry tomatoes, and hot peppers. Okay. Then avoid eating too much junk food, too much processed food. And of course, I don't mean to make you paranoid. It's not like if you're opening a packet of chips and then you're thinking that, oh my God, I'm going to get cancer. No, I mean, I still lead a pretty normal life. I eat everything, but moderation is the key. Okay. Try to have everything in moderation, and make sure to add certain food items in your daily diet that will help you to improve your immunity, that are anti-inflammatory in nature. Okay. Use safe cookware storage containers. So try to reduce the amount of plastic that you use at home, and more of glass and steelware. Try to avoid using or cooking in non-stick, because non-stick cookware, if they have any amount of scratches, it becomes very harmful for your health. Sleep well. So when I say sleep well, one thing is, of course, that 6 to 8 hours of sleep for adults. And secondly, it is also about the time, so our hormones are balanced between 10:30 to 2:30 when we're sleeping. But if you're not sleeping in that time, then we lose out on that precious time to take care of our health. So as close to 10:30 that you can sleep is good. If not 10:30, 11, 8 or 11:30, but as close to that time, it is good for us. Then consider earlier pregnancy, of course, like I said, that the first biological child before the age of 30, and know your personal and family history. Many times we don't know if our grandmothers or, great grandmothers, what they may have passed away from. But it is important to know that, when we're talking about breast cancer, especially. So do ask your parents, if there is any family history, because breast cancer especially can skip generations also. Then these are some of the food items, like I was sharing with you, that, it is important to add some food items which are rich in vitamin C, which improve your immunity, which are anti-inflammatory in your daily diet. So have a look at these food items, and you don't have to make a list and keep checking off every item every day. Just add 2 to 3 items in your daily diet that you feel is comfortable for you. And if you want to ask as to how to take any of this food item, then you can ask me once we open the house for question and answer. So that is all from my side. And this is one of my favorite slides, which does talk about eliminating stress from your life. And I feel this is so true when I say stop overanalyzing life. One of the major reasons why we have so much tension and stress in our lives is because we overthink about everything, and we overcomplicate and overanalyze everything in our mind, right? Let's not overcomplicate everything. And there's so many ways to keep ourselves happy, healthy. The most important thing is that always remember that you're the hero of your life, right? So do things that give you peace of mind. Like my mantra in life, if I have to decide on certain things, I have to take decisions, is to think, is to sit and think whether this will give me peace of mind or not. If it is not giving me peace of mind, then that is not the right thing for me to pursue, right? And this is something that you can also start to think about, and life becomes easier that way. So thank you so much. And any question answers that you have, I'll be happy to do them.
Okay, thank you, ma'am. I ensure that seminar will be profitable and fruitful for everyone present here.
I hope so too.
Okay, so first question was, okay, what if there is a cyst in breast, but while in ultrasound, it's not showing any serious issue? So what to do in this case?
So, firstly, all kinds of cysts in the breast are not malignant. Cysts, typically 90% of the cysts are not malignant. So, if somebody does have a cyst, which after ultrasound and after checking by the doctor, they're saying that it is just a cyst and it is not malignant in nature, then that's okay. It may not be malignant at all. So please don't think that any, like I said before also, that any change in your breast, if you find, it is not necessary that it will be cancerous. Most of the times, rather, it would be non-cancerous. But unless you go to the doctor, you will not get to know on your own.
Okay. So next question is, how can I manage the side effects of breast cancer treatment?
So this is a very general question, because breast cancer treatment involves so many modalities. Every medicine has different kinds of side effects. So this is if the person who's asked this, if somebody is undergoing breast cancer treatment that you know of, then you can discuss those issues with me. But on a generalized basis, see, one thing is, I'll share something with you. When I was undergoing my treatment and when I was about to start chemotherapy, me and my husband made a pact that I will not go to Google. It's the easiest thing to do, most tempting thing to do. But if you Google even about crocin, trust me, you'll not be able to take crocin also. So firstly, please don't Google about side effects for about treatment of cancer. One. Number two, don't pay attention too much on the side effects, because that is when you start to feel more side effects, as a matter of fact. Thirdly, some of the common side effects of treatment, one is of course hair loss, but I don't consider that as a side effect. That's because that's a very temporary thing that happens. I mean, yes, a person has to lose hair, but then these are my natural hair. So every inch of your hair comes back, and I've seen women getting more beautiful hair after, when they come back. So there's nothing to feel scared of in terms of losing hair. And then certain things like, yes, you feel very weak at least for 2-3 days after every chemo cycle, but it is mostly for 2-3 days, after which the person starts to regain energy. And always keep your diet very nutritious while you're undergoing treatment, because that takes care of your blood counts, that takes care of your immunity, and that also takes care of your health in general and your strength to take the treatment well. And keep taking things that will improve your hemoglobin level. So it could be spinach soup, it could be pomegranate juice. And also make sure to not eat food from outside or not take uncut food from outside. Always have home cooked fresh food, because anyone undergoing chemotherapy becomes very prone to outside infections, because the blood counts are very low during chemotherapy. And then if you have something specific, then please ask me. I'll be able to help you out there.
Okay. Oh, okay. Our next question is, how will treatment affects daily activities? Can we still work full time?
Yes, you can. As a matter of fact, see, one thing is that breast cancer treatment, the side effects from the treatment are different from every person, different for every person. Some people have, as a small example, I see people who have reactions in their skin because of breast cancer. Some people's nails turn blue, while others do not have any such side effects at all. So one, it depends from person to person. Number two, I know a lot of women who have continued to work even while undergoing chemotherapy. So what these women do is that they plan their chemotherapies in a way that they take a chemotherapy session on a Friday. Then rest of the Friday, Saturday, Sunday, they take rest, and Monday they're back to work. Right. But again, like I said, that each person to its own, not everyone may have that kind of energy all the time. So when your body tells you to rest, please make sure to rest. But otherwise, even those who are not working professionals, continue to work around the home, go for walks, continue to do your own chores as much as your body allows. And for people who are working, like I said, I know a lot of women who have continued to work even with the treatment on. And a lot of it also depends on how you're taking it, psychologically. If you want to continue leading a normal life, trust me, the treatment becomes easier for you.
Okay. Okay. Our next question is, what is the lifetime risk of breast cancer?
So in India, 1 in 28 women would supposedly have breast cancer, but this number is also going down. So probably in some time to come, in 1 in 22 women. Outside, like in US, it is 1 in every 8 women in their lifetime will have breast cancer, which is a very, very big percentage. In India, it is currently around 1 in 28.
Okay, our last question was, when do you think someone would begin screening for breast cancer?
So, like I said, that the self breast exam has to start after the age of 20, and screenings by the doctor starts after the age of 30. So, self breast exam every month after 20. Added to it, a clinical breast examination by the doctor once every year after turning 30. Added to that, a mammography once in 2 years between 40 to 50 years of age, and once every year after turning 50. And if somebody has a strong family history, or if somebody does have any changes in the breast which are not malignant now, but a doctor does fear that the person is at a higher chance of breast cancer, then these frequencies may vary.
Okay. Okay. Thank you, ma'am. Thank you, ma'am, for the session.
Thank you so much.
Okay.
And I
Now
hope that all of you will talk about this to your family members, friends, everyone outside.
thank you all for joining. Ma'am, lastly, would you like to say something as a conclusion or message to our audience?
So just two things again. One, like I've been telling you, that please share this information with more and more people. Don't just keep it to yourselves. And number two, let's all be heroes of our life and take responsibility of our own health. Regular exercising, good amount of sleep, managing stress, and eating right. 4 mantras to lead a healthy and happy life.
Okay. Thank you, ma'am. Thank you, ma'am, for joining.
Thank you,
Thank you
everyone.
for the session.